You are live.
Good evening. My name is Zoe Pofu, and I'm welcoming you to Let's Talk COVID Early Childhood Education. Today, we've got an exciting number of panelists contributing to this conversation as we explore what early childhood education looks like during this time of COVID. Kicking us off today will be Commissioner Al Whitesides of Buncombe County, followed by Jenny Bile, Chrissy Wolf, John Williams, the Reverend Spencer Hardaway, and Suzanne Creede. So with that, I'd like to open up the floor and have each of them introduce themselves and share a little bit about what they'll be discussing during our Let's Talk COVID Early Childhood Education discussion. Commissioner Whitesides, welcome.
Yeah, good afternoon. I'm Commissioner Al Whitesides. I represent District 1 in Buncombe County, and I'm a member of the pre-K committee.
Hi, my name is Jenny Vile. I'm the Child Care Resources Director at Buncombe Partnership for Children, and I'm going to be talking a little bit about the impact of COVID-19 on our local early childhood child care program landscape.
Hi, my name is Chrissy Wolf, and I'm a child care health consultant employed at MAHEC, our Mountain Area Health Education Center, as a direct service provider through a grant from the Buncombe Partnership for Children. Today, I will share my role as a child care health consultant in assisting child care facilities and family child care homes in providing a healthy and safe environment for children and staff in child care settings.
Hey, my name is John Williams. I'm the project manager for the North Carolina School Age Initiative. We are directly funded by the Division of Child Development and Early Education. And today we are going to talk, I'm going to talk a little bit about after-school programs, how COVID has impacted after-school programs and summer camp programs, and a little bit about the workforce issue that we're seeing with this pandemic.
Hey, my name is Susan Creede. I'm a communicable disease nurse with the Buncombe County Department of Health, and I'm just here to talk about disease investigation and surveillance.
I'm sorry, I missed my cue. I'm Pastor Hardaway, Rock Hill Missionary Baptist Church. We also do Project Lighten Up, Virtual Learning Academy, which is a new program, and the Summer Day Camp and After School program. So I'll talk in reference to the Virtual Learning Academy, what we did for the summer camp, and our after school program. Thank you. Good to be here. Thank you.
It's great to have you, and Reverend, you are always on time, so never a minute too late. And so with that, I'd like to now open up our discussion, and we will begin with Commissioner Al Whitesides. So Commissioner, can you please start off by sharing with us why is early childhood education important to you? And then also, can you also share with us, what special connection you have and the connection that this resource has for our community as part of our COVID-19 response?
Well, to start with, as a parent, a grandparent, and a husband of an educator, and serving 24 years on 2 university boards in the public school, Asheville City School Board, I found out early on that the foundation for education in this country is pre-K, or early childhood. And unfortunately, we leave it out too often. And we're trying to correct that here in Buncombe County. When I came on early on as a commissioner in 2018, we decided and we voted to establish the Early Childhood Fund with $3.6 million and to increase it 2% a year going forward. But hopefully we'll be able to do more than that in the future because of the need we already see. And Buncombe County in 2025, our new strategic plan includes education as a focus area with kindergarten readiness as the first piece of that. We want to invest the funds and make the policy decisions needed to move the needle on the child care crisis, because wherever I speak or go or talk to constituents, child care or the like of it for early pre-K or the early child care is missing in Buncombe County. We just don't have enough. And we want to see more children in high quality care so they can be successful in their development. And child care is also critical from a workforce perspective for families in order to maintain their jobs. And I saw this over and over again the 40 years I spent in banking, because I lost a lot of good people because of childcare, especially if they had several young children. That was a problem. And we have really walked into so much, and it's affected early childcare too, this whole COVID pandemic. And we've been fortunate, though, that our committee, we've been listening. We're excited. One of the things, our committee held a listening dialogue with the early childhood grantees last month. And we heard about the challenges that centers are facing keeping their classrooms open. As a commissioner, I'm also hearing from families who are having a hard time making ends meet and facing the extra cost of care, let alone finding a slot for their kids. And that is still a problem, because I hear people who, when they become pregnant, they get on the list and still 9 months later, they have problems getting childcare. And what we did do, we have helped. We put $400,000 into the child care subsidy program so that more families can get help paying for care. And we were able to do that from some of the COVID-19 funding. And we even increased the eligibility so that people making up to 300% of the federal poverty level can now qualify. And we continue, like I said, to hear from different parts of the county, no matter what the economic level is, child care is a problem for everyone, and it continues to be. And anyone interested in applying should contact Buncombe County, our HHS department. And we continue to give this number. I love giving it out. It's 250-5500 if you have any questions or whatever. But as I said, the commissioners are committed. And from what I've heard, even if we have any changes on the commission during the election, the people who are running, child care is one of the keys for all of us in running. And it's one of the pillars, and I can't say this enough, of our new 5-year strategic plan that went into effect in July of this year. And our strategic plan that we have put in place this year is just not on paper only, because every quarter we will get an updated report on how it's going through all the pillars. Child care is being one of the major pillars of that.
Well, Commissioner, thank you so much. It is really helpful for us to understand that how early childhood is a piece of the strategic plan, and then also how you as a commission body continue to invest in that very key resource. Before we move on to our next panelist, can you please share with us how the county has been addressing the concerns of the facilities specifically? You know, you have shared at least the investments and the implementation as of July. How has this impacted the direct facilities since COVID?
You mean how has COVID affected the facilities?
Yes, yes.
Yes, that's been a problem. We've seen, you know, with some facilities, it's not been easy. A lot of parents are working at home now. so they're keeping their kids out. Some are fearful, well, because of the pandemic, to let their kids come. Other facilities are having problems, with finances. So we're seeing a lot of different problems going through this, but we're trying to work with the facilities on an individual basis because, no two are having the same problems. So we're trying to address that, or our staff in the county, as we see, as they come up. And also, we're getting to the point now, we'll start next month and virtually visiting all of the facilities that we've funded to see how they're doing, to hear from them and to see. Unfortunately, I'll miss not going out like we did last year to see the facilities, but because of the pandemic, we're going to do it virtually this year.
Well, it's certainly great to see that even our commissioners, that you're still in that place of relationship building and connection with those centers and really using technology as a bridge, just like we are here today. So thank you, Commissioner. With that, I think that this was a fine time for us to transition to Jenny Vile, who will share a little bit more about the connection of her work and her role with the Buncombe Partnership for Children. Jenny, welcome.
Thank you. And thank you, Commissioner Whitesides, for that great overview of what's been going on with our early childhood system. So Buncombe Partnership for Children serves multiple roles in the community. As a community nonprofit, we do funding and supporting and running some programs for young children and their families and their caregivers, which means everything from we administer the North Carolina NC Pre-K program in Buncombe County. Subsidy funding comes in part through the partnership. Some parenting programs like Chrissy's, and then programs that we run in-house, like the child care resources, which is mostly what I'm going to talk about tonight. We exist to support early childhood educators and administrators, and also the workforce development program, which is working on bringing new teachers into the field and supporting them early on, which has been really important recently. So because we're thinking about COVID, really we have been focusing on how do we support early childhood programs through this, right? Keeping people open as much as they can. If their decision has needed to be to close, how can we support reopening in a safe way? We're seeing, just like Commissioner Whiteside says, every program is a completely different story, right? There's a lot of common themes, but financially and in terms of staff and in terms of families and attendance, every program has a little bit different story. And trying to keep up and trying to shift our work from more long-term kind of teacher practice development and looking at best practices and classroom best practices, which of course are still really important, to day-to-day, how do we stay open? How do we serve these children and families safely? And how do we make sure that programs are making the best choices and have all the tools and the information they need to make choices that feel right for their program, so they can continue to serve children.
So with that, can you talk a little bit about the pivot that Buncombe Partnership has made since the start of COVID and the availability of early childhood learning centers?
Right. So we have been really working with the state, working with programs like Chrissy's to monitor who is open, who is able to be open, and who has not, to kind of keep tabs on how many slots are available in the community. So the most recent count is we've got about 3,000 children across the county in licensed childcare right now. So programs that are licensed by the Division of Child Development and Early Education, that's down from about 5,000 in January. So we've come up a fair amount. We have a lot of programs open, a lot of classrooms open, but still there are a lot of centers that have reduced their capacity, either due to feeling like this is as far as we can go, this is as many children as we can safely serve, and some we've had a lot of teachers that have stepped out of the classroom either because of their own health or to care for their own children at home. especially at another group of teachers that have been unable to return due to school not being in session full time, and that aspect of it, which I know John is going to talk about more in a little bit. And so as far as our services, we have really shifted our technical assistance and coaching and training from in-person, which is, our staff spend a lot of time in classrooms directly supporting teachers, doing trainings in person, both in our office and on site, to doing all of that online. And also shifting to looking at stress and resilience, and how can we really support teachers in acknowledging that this is a crisis and this does not feel like normal work, and that expecting teachers to show up every day requires some extra support. And what does that look like, and how can we help them get training hours while also being really realistic that this is really hard, and that they, real life keeps going in the background, whether or not they're at work. So offering as many opportunities to learn about the impact of stress, and how can we just be supportive, while also offering required trainings, right, that the state we have to have. So how can we do that? We're doing CPR, for example. We're doing CPR outdoors in a covered space in very, very small groups, so that people can get their certification, but stay more than 6 feet away, have their own mannequin. So just a lot of creative, how do we shift and offer, give people what they need.
Yeah, it's great to hear how nimble you all are. So how is the training, the virtual transition for our adult students? We hear a lot about this for our young ones, all the way up to high school and even university. So within this, as a continuing education or workforce development, how are our early childhood education educators making that transition?
It's been a surprising mix, actually. We've had some people that it has been really hard for, and it's been a tough shift, but they have been able to figure it out. We've had some other people that have said, I'm just going to wait till I can do it in person. And then we've had some others where it has opened up a really great opportunity. Like, for example, program directors that don't like to leave the center in the middle of the day, who can join us virtually, for an hour at nap time. And we've had a really active directors community at practice, where they've been coming together and really connecting with each other and sharing. Same thing with our family childcare home providers, who are family childcare homes. It's a license where they're at home, in their own home with 5 to 8 children, and it can be kind of isolating. And they have been meeting once a week together to do some training and some connecting and really troubleshoot what has come. So, there's definitely been some challenges, but there have been some really great bright spots as well that I think we will continue after the pandemic. So yes, and both.
Yes, and both. It is great to hear that even our early childhood educators are finding that note of resilience, and are to kind of finding the lemonade out of the situation. Yeah. We know it's tough, and we know that they have definitely been showing up as another asset in our first responder roles. Right. So I thank you for sharing that, and it's great to know that the other half of the education component, at least the workforce, is still able to continue in that enrichment. And so I thank you, Jenny. I think this is a perfect time for us to also hear from Chrissy Wolf, who does also support some of that. So Chrissy, can you please at least reflect from your role and your work?
Yes, and thank you, Jenny, for including some of the trainings that I do come through the partnership. And so we collaboratively work together throughout the whole year. But since 1999, 21 years ago, the child care health consultants have worked with Buncombe County early childhood and education programs. And we've done this by assessing and planning and implementing and evaluating strategies to achieve high quality, safe and healthy child care environments while following the child care rules, the regulations, and of course, best practice. Child care health consultants, or better known as CCHCs, to the child care community, provide trainings, technical assistance, and coaching in all areas of health and safety relevant to child care. A few of the trainings that we do offer are medication in child care, safe sleep to reduce sudden infant death syndrome and emergency preparedness and response in childcare. But CCHCs also collaborate with programs and families to care for children, inclusion of children with special health care needs. As CCHCs, we also observe the health and safety practices in childcare classrooms to provide coaching and preventing and managing infectious diseases in childcare. We assist programs to use current, evidence-based criteria for identifying, caring for, and excluding children who are ill, or also for identifying staff who are ill and should not be working at that time. CCHCs have continually provided consultations on improving the health and safety of policies and practices, including hand washing for both children and staff. Those health practices have been well established in childcare facilities for many years. We provide teaching activities for children and staff on hand washing and posters to follow all steps to hand washing and when hand washing should occur, because it occurs a whole lot in childcare. But doing hand washing in childcare is nothing new, because childcare has been required, and we have worked with them about hand washing at all the different times during the day when it's required. We also assist programs to reduce the spread of illnesses in childcare by strengthening environmental health practices, providing coaching for sanitation issues, on cleaning the childcare environment, and following procedures for changing a child's diaper. The CCHC focus has not changed despite our operational changes resulting from COVID-19. Consultation and group trainings, our general resource sharing with an emphasis placed on COVID-19 has continued through remote instruction of real-time virtual trainings, outdoor physical distancing consultations, and providing on-site consultations to meet the needs of children with medical action plans, providing required in-person trainings with hands-on skills at childcare facilities. And this too has been accomplished through remaining outdoors and maintaining a physical distance and the use of face masks.
Wow, it sounds like you all continue to be busy. And so, you did mention that, even before COVID, there was, rigorous culture and reinforcement of hand washing. Can you speak a little bit about any new policies that have come out of COVID? And then also, besides that, what happens when a center is not diligent about implementing those policies? What are the consequences?
Well, there have been many childcare facilities that have remained open to care for children and have never closed their doors during this COVID pandemic. So I'm so grateful for them to do that, and having received many trainings from us before on how to eliminate illnesses and viruses and to manage those in childcare. But they were required to complete an application attesting to make every effort to meet the guidelines in the Child Care Strong North Carolina Public Toolkit. And that guidance is intended to help child care facilities make informed decisions about COVID-19 and minimize the risk of exposure to both staff and children in their care. Each topic in that Child Care Strong Kit was developed to protect people in the child care facility to minimize the spread of COVID-19. The CCHCs, we have been reviewing and assisting in the implementation of that Child Care Strong Toolkit that provides the requirements and the recommendations for children. We've done that through assisting them with dropping children off in the mornings, that arrival procedure for signing children in, also making sure that avoiding close contact with other families as they're dropping children off, monitoring for COVID symptoms throughout the day, and when to return to child care if they've had symptoms for COVID, and working with the Buncombe Department of Health and Human Services on when to return if they have had that potential exposure or have had a positive test. But preventing the spread in the classroom and minimizing the spread to others, we've done that by working with centers on keeping the same group of children together with the same staff, not overlapping classrooms, either inside or even outside in the outdoor learning environment. But the toolkit also addresses that daily health screening for COVID-19, which we're all doing these days. But that is for staff and children, or for anyone entering the child care facility. And at this time, it's recommended to only allow those to enter the child care facility who are needed to maintain that child ratio. If we encourage and they are required to follow that toolkit, if that is a lack in some of that, then that is licensed by the Division of Child Development and Early Education. And there is a possibility that if they're not following that they may lose or it may impact their funding. But each of us on the panel today, we work together, we're collaborating in order to give them our best so that they don't have to suffer any of those consequences. The child care health consultants, we're working with facilities to implement that toolkit by going over the screening and the hand washing, the sanitation, and the exclusion, as well as that general health and safety practices in the classroom. And we also facilitate the communication with the health department, including environmental health, and provides follow-up for those recommendations.
Well, thank you so much for I think informing and educating all of us because obviously you're asking for us not to show up unless we have, that immediate need.
Right.
And so it's really helpful to have that reminder. Can you just give us top line for some of those folks who may not necessarily be leaving home every day? What does that initial assessment, that daily overview? So what are some of those things? Is it temperature? Is it the symptoms? So can you just give us top line, a couple of examples of what that, day-to-day well check for students and then also for your instructors? What does that look like?
Upon arrival in the mornings, there has to be a verbal exchange of information between the families and the children. With the child care staff there. Child care staff is required to ask them if their child has been exposed to anyone with COVID symptoms, if they've been contacted by the local health department that they need to be excluded. They're doing temperature checks. Buncombe Partnership for Children and the CCHCs distributed thermometers, 300 thermometers through a grant that was received, the child care providers back at the beginning when it was so difficult to get those. So they're doing those temperature checks. They're looking for that child throughout the day if that child is unable to participate in activities and checking those temperatures around lunchtime, around nap time, they'll check it again. So that if they have to see any of those symptoms, that yes, they will exclude for those symptoms. To go home and remain home for a period of time.
That's also helpful. Thank you so much, Chrissy. And with that, I think would like to welcome John Williams. And John, if you can, please share a little bit more about what does this work look like at the state level?
Exactly. Thank you again for having me. I'm so happy to be here in a group of like-minded individuals who acknowledge the importance of early education. And I think one thing that this pandemic has done, it's really shown us how important early education is, not only to students, but to the greater community and to the workforce. One thing, when we look at school age care, I think so many times we focus on birth to 5. We have to remember that child care also includes students who are ages 6 through 12. And that's things like after school care, summer camp care, wraparound care, things like that. And one thing that this type of care does that benefits students is it gives them a safe place to be. And I think that's one of the things that we've really focused on during the pandemic is how can we as citizens of this state, and how can we as people and individuals who provide early education expand and really grow and expand our centers to include spaces for these students to come in a safe space. And I think that the Division of Child Development and Early Education has done a great job of really expanding resources to early education centers, expanding resources to school age facilities, offering grants and things like that to help this issue, because we want our students to be safe. One thing that we kind of talk about in the school age field with after school care is risky behavior. Things like teenage pregnancy, things like drug use, things like alcohol use, that increases when students don't have access to proper after school programs. And so if I can encourage anybody legislatively, community-wise, really advocate for these programs, because it really provides a space for students to grow It closes the inequality gap that we see statewide, and it really it fosters success for these students. And on top of that, it really helps our parents and our workforce. A lot of jobs extend past 3 o'clock when school ends. From 3 to 6, those are the critical hours for a lot of families who are really trying to make ends meet. Lower income workers, people who work in manufacturing, things like that, retail workers. Those hours from 3 to 6 are important, and after school care provides a great support for those families. So remember that in everything that you do, and especially when we think legislatively, when we think of academically and things like that, we need to really remember these students and the impact that after school care really has upon the whole network of our citizens in the state.
Well, John, thanks for really pushing our conversation upstream, as we like to say, to the policy level, and thinking a little bit, further out of just the classroom or the child care center. I think I would ask, because you're thinking big, can you tell us a little bit about the numbers? So you're talking about the impacts or the outcomes
Exactly.
in terms of that this service is laying a foundation. Can you tell us a little bit more about the numbers that you see and connecting it to this early childhood education resource?
Big time. I mean, when we think of before the COVID pandemic happened, we had over 3,000 sites statewide that were providing licensed school age care for students age 6 to 12, 5 to 12, if you include kindergarten. And we saw a rapid reduction of that. The National After School Association is crunching some numbers federally, and they're showing up to a 40% decrease in the number of facilities that provided after school care. And that's because of funding, federal funding that was not able to trickle down to support these the continuation of these programs. We also saw in the state of North Carolina, a large majority of after school and summer camps services are provided by the school systems. So when these school system buildings close, these students don't get the services that they need, So we saw close to 80% of schools during the peak of the COVID crisis, probably around May, closed their services for these students, and that left a tremendous hole in summer camp education extension. We talk a lot about the summer slide and a lot about how students during the summertime regress academically, and school age programs help to bridge that gap. Well, with the school age system or school age programs not being able to function, I think we're going to see academic regression that's going to last years down the road, just because of one summer that's missed. Same thing with virtual learning. It's a great Band-Aid right now, but I think we're going to see some regression that is going to take us a decade to recover from. So one thing that I can say, though, is during this crisis, family child care homes and early education centers, licensed school age licensed child care facilities have really stepped up and done a great service for the state. People who own family child care homes, people who run early education centers have put themselves in harm to care for students and to care for the families that they serve. And they are definitely the heroes that are often are unsung. So we need to remember them, remember the service that they're doing, and the sacrifices that they're making.
Well, you remind us of some, very clear and candid truths. I thank you, John, for sharing all of that. I think that I'm certain that with a collective approach, that these major challenges that we face can be addressed, and that we together can get all of our students and scholars back on the path to the healthy education story. And so with that, in terms of unsung heroes and those that are filling in some of these gaps, I'd like to welcome Reverend Spencer Hardaway, pardon me. Pastor, you have the floor.
Thank you. Just want to say, again, I appreciate being here with so many people that are also interested in the education of our children. I'm trying to provide a way to see our ways through this pandemic. I do want to say thank you to the county County Commissioner Whiteside did mention how the county is making efforts to provide some kind of funding for education for the least, the last, the lost, but also for everyone. And so again, appreciate the funding that they provide. Also, they are coming out to our site around the 29th of October to visit us and see what we're doing and see the impact we have. One of the things I think we've hopefully learned here is that education should be given to everyone, but also as a community, families have to understand and realize we cannot outsource or contract our education of our children to somebody else. There's a responsibility that parents have to say, I need to teach my child, I need to be involved in the education of my children so that I'm on top of what's going on in their lives, so that again, make sure that they're doing their part of it. Then the system has to be accountable to saying, hey, we're trying to reach everybody, just as they're making efforts to reach every child. Now, since we're going virtual, they should use that same kind of determination and effort to say, once we go back to some kind of normal, or whatever that's going to look like, that we're going to use that same kind of passion and determination to make sure that every child has an opportunity to receive education. So again, I applaud the county, applaud everyone here who's involved. And again, hopefully we learn some of those things that, again, we can't outsource the education of our children. We can't contract it out, that we need everybody. And those words which says, it takes a village. Now we're seeing there's a lot of players, a lot of involvement of people around the community that's going to ensure that children have an opportunity for education. The 2,000 days, as John was saying, you know, we look at saying we want to impact the next 2,000 days beyond. With our summer camp, it's designed to shorten the achievement gap by preventing summer learning loss. So we've been doing this since 2012. And again, our camp is unique because it blends education and recreation into daily activities. So they'll go through reading, they'll go through math, because the stats say that children, students lose 2 grade levels of reading and math during the summer. And so we focus on those. And reading incorporates comprehension, it incorporates spelling, and so it incorporates a lot of other things. So again, reading, math, personal development, we're trying to help them develop good self-esteem, good images of themselves, arts and craft, that enjoyment piece, and recreation at the same time. Thursdays would be our educational field trips. They've gone to WLS, they've gone to UNCA. At one time in years previous, they've actually went out to UNCA, and our middle school kids actually built a hoverboard out of plywood, canvas, and a vacuum cleaner, and it really worked. So those are some things that we offer. Program which we've done in about the last 3 years, we realized that we wanted to extend not just for the summer, but we also wanted to provide something for families in the school during the school year. So we shifted some of our resources to do the after school program, and it's set up so it's not just remedial help, but not all kids need remedial. So there's some enrichment opportunities. We follow a STEM program where there's STEM projects that they're involved in. We do the tutoring, we do the mentoring. We try to make sure that they have a good sound start academically. And we're trying to ensure that when they kids start this year, that next year they'll be further ahead than they were when they started this year. And then with the pandemic, again, we had to do another pivot and shift. So we shifted saying we want a virtual learning academy. It was an easy move, an easy transition for us because we're doing the after school program. And so working with the county, Buncombe County Board of Education, saying, okay, we know that there's parents out there who cannot be at home. They've got to work, whether they're low income families or middle income families, they have to work on a place where their have safe and get some quality mentoring or monitoring. And then also low-income families. So what we do have a virtual learning academy. The students will come, we'll work with them as they go online. We'll make sure that they stay online. With kids, sometimes kids will be in the session and they'll minimize the session and highlight going to somewhere else. So we try to monitor that, make sure the kids are in session, in school. But we believe education has to appeal to the 5 senses. And so there is someone there that when they're not in session during the day, that we try to work on them one-on-one with some issues or to strengthen that virtual learning. We know that virtual learning, that there are some things that they can't do during the session. And so we try to have somebody there that will work on math, whether it's reading, whether it's math, so that there's someone there that can help monitor and help facilitate some of their learning. We've had to make adjustments due to COVID. We had to follow CDC guidelines. We couldn't have as many students for the day camp as we did last year. Normally we would have 100, so we had to cut down to 25 once we've got that notice that we could do that. We have to have the daily, this building has to be disinfected on a daily basis. There has to be the screening. We do the 5-question screening, hand washing, mask wearing, and it's a challenge getting 5-year-olds, 7-year-olds, 8-year-olds to remember, put your mask on, Oh, I lost my mask. Okay, here's another mask. And so those are some of the challenges. But at the same time, it's when people say there's some things that they can't do for whatever reason, we found that the people in the community, it spurred them into some activity. They say, well, what can we do? And so we've got volunteers that we've got to send through background checks. We've got to make sure that they've got tested negative on the COVID-19. So we try to make use of them. If you can come 1 day or 1 hour, that's fine. Just as long as we take all those CDC precautions to make sure our kids are safe and our staff is safe. We keep them contained in a room so we don't change classes like we did during the summer. Last year, everybody had to, so that means the teacher had to go through the math, had to go to reading, had to go to arts and craft, had to go to the recreation. So they had to do everything. And we looked at one room schoolhouse almost. Right now we have 20, and we've got different rooms that we have them occupied in to make sure that they don't, that they stay on time on task.
That is such an amazing and dynamic program that you're offering, Reverend. I'm so happy to hear that. You all are doing so much. I think that it's important for the community to hear about a small local program that's also serving our students of color. And as we are thinking about the ways in which our communities, populations are uniquely impacted, I commend you for giving lift and introducing your students to science, technology, engineering, and math, or STEM, as you did mention. And then also another takeaway that I heard from you is that you are also supporting and reminding us all of providing a social, emotional, and learning component to all of this. So thank you so much. One final question before we move on and hear from Susan Creede with our communicable disease nurse team. Can you tell us just very briefly what has been the mask usage adoption of some of those younger students? I heard you say the 5 to 7. How are they adhering to mask usage? And is there something that we may all learn from them?
Well, yeah, we're covering from 5 to kindergarten to 8th grade. They're resilient. And again, it's a challenge to keep them masked. It's just reminded them because they're really, it kind of hinders them from talking and speaking. Then we got to work on their pronunciation, so that hinders that. But we're working through that. If I understand that's the question. But again, they're resilient. They're cooperative, but they'll forget a mask. You gotta have one for them. The mask will come down. One of the things I think we found is that sometimes the kid's mask doesn't fit a 5-year-old very well. So they tie up the loops or something like that. So those are some challenges that we have. kids are resilient, they adapt, they overcome, you know, and they're just glad to be there. They want a hug. I gotta say, okay, I got a social distance, you know. But those are just some of the things that some of the challenges that we have that I think it all makes it all look worthwhile.
Well, thank you so much.
We have
And
one of our children, they scored 100 on one of their tests, and so the school came and gave them balloons, and so one balloon, and so that was a highlight. And he was so excited. The mother was excited, and we said, "Hey, we're doing the right thing."
so we're so happy to hear that even in COVID, that we can still find a way to make some memories and really be able to celebrate some of those key milestones, like a 100%, A+ grade. And so, in thinking of A+, I would love to now invite Susan Creede, and she is with the Buncombe County Communicable Disease Nurse. For all those who may not be aware, our Buncombe County Communicable Disease nurses have been at the helm of this COVID response. Everything from responding to our ready calls to supporting our all those who are in isolation, our contact tracing, you name it. Many hours, such great expertise, so much compassion, so much empathy, and so much heart. And so with that, I want to welcome Susan Creede.
Hi, thank you so much. It was very nice too. First, I would like to bow to all of you guys because the continuing education of our youth is the basis of all of our future. And so I understand all these challenges and can't imagine the detailing that has to go in on a day in and day out basis. So I applaud you all. Thank you very much.
So Susan, can you tell us a little bit about your role as a CD nurse to supporting our early childhood centers, particularly from an environmental health perspective?
Well, first of all, Buncombe County has always had a communicable disease team. It's typically been made up of 5 nurses. That's on steroids now, so to speak. But we've always been poised to help mitigate and organize and prevent the spread of disease. And so with COVID, it has beyond our wildest dreams of how we have to pull things together. But we, have a system that we've worked with for years. It's typically a 10-step approach. The highlights would be, focus on identifying your source, and then to develop a strategy to mitigate that spread of infection, thus curtailing an outbreak from happening. Evaluate your response strategies, and also communicate is key across the board. What your findings are and what your ideas are for the stop of spread.
So when thinking of the stop of spread, is there anything that you can recommend to all of today's viewers on how we may actually support little ones or kiddos in terms of protecting them from COVID and reinforcing some of those behaviors that we're trying to reinforce for adults as well?
Right. I will tell you, I am not the expert there. Children, they grow so rapidly. So each age group is going to be defined by a different set of needs, right? Our 2-year-olds can't wear a mask. Our 5-year-olds find that a challenge, but also we can kind of maybe play with the superhero thing with those guys, and so each age group has its own unique set of challenges. And thank goodness we have you guys as experts with growth and development and all of that. I'll have to echo strongly what Chrissy said is about hand hygiene. The single most effective way of preventing disease is washing your hands. Singing the alphabet, it's a 20-second takedown, wash your hands, sing the alphabet, sing happy birthday to yourself, wash your hands. When in doubt, wash your hands.
a reminder that it's the low tech things that really make
It is,
all
and
the
it always
difference.
has been. Yeah, it always has been. And so we kind of forget how simple some things are. Washing your hands is the oldest remedy that we have, but this new distancing and mask wearing, it's tricky. I mean, it's fatiguing. I feel suffocated after a while from wearing a mask for a long time. I have a history of asthma, and so I can imagine how little children are. They're so excited, and they'll talk until they run out of breath sometimes, and I can't imagine doing that, like with a mask in and day out. But it's so important, and it's so important too that I think we make children a part of it and just not dictate to them. Let them know that they are part of this solution, that them wearing that mask and them washing their hands and them reminding people and 6 feet apart is important. And it's not only important in their classroom, it's important in their families, and it's an important aspect of their position in the world.
Thanks so much for reminding us that, because I will say that quite often it's all about lighting the experiential approach for students and for kids. It's really by modeling and also respecting their capacity and ability to learn. And so at this point, I would say I'd like to open up the floor and just ask everyone some questions. And the first one that I'd like to put out there, and Jenny, you actually may be able to start us off with a response. In terms of, that, what are we seeing in terms of our students' capacity? And can you reflect a little bit on how our educators, as you may be aware, with the Buncombe Partnership for Children's Centers or through Verner, how are they actually imparting this message to some of our youngest Buncombe County residents?
I've seen some really great playfulness around mask wearing, and some really great, just even I'll talk about my own 2-year-old. So my 2-year-old was in full-time childcare, and she did not go back after her center opened up. And I've been really, like most parents, right, really stressed about how is this impacting her, and how is she, all of these things. And she sees these masks all the time, and she can't hug her grandma, all these things, right, that we're all thinking about. And she misses her teachers. And then a couple weeks ago, she's got a tiny mask, and it's so cute. And she brought me her mask, and she said, like Aunt Sarah. And I was like, what? And I went, oh, she's not seen her aunt without a mask for 6 months. And it wasn't stressful to her. It wasn't a big deal. She just wanted to be like the adults that she loved. And she wanted to put on that mask, right? My thing is, I think kids are less stressed about it than we think they are. And if we just are this is just what we're all doing to keep each other safe, most preschool classrooms have maybe 2 or 3 rules, and one of them is always, we keep everybody safe. And I think that for kids, for especially preschool kids and younger elementary, it is really easy for them to slot that in to the rest of what preschool is about, right? It's about keeping each other safe. It's about keeping each other healthy. And I think it's less stressful than we think it is. I mean, not that I haven't argued with some kids over some masks, right? But I think once teachers have really embraced it, and it's helping kind of keep everything, it's just kind of what we do, right? And teachers are resilient and children are resilient. And I think that, as frustrating as the length of the pandemic has been for everyone, and I think the initial rules and the changing of the rules a lot, especially early on, I think that most programs have fallen into, well, it's really hard, and I hate to say the phrase, but a new normal, right? A new normal looks like each kid has their bag of masks, and the teachers have them, and we just roll with it.
So just thinking of this new normal and the changes, I'd like to just throw out to the group, what is kind of a good change that you all are seeing out of COVID and its impact on early childhood education, if we can at least reflect on the positive?
I think one thing that we've seen is starting conversations on trauma and resiliency. This whole pandemic has been traumatic for everybody in different ways. And I think through this, we were able to reflect on the children that we serve, reflect on the teachers that we work with, the parents that we work with, and see that they're dealing with trauma too. And that together as a community, we could come up with ways to become resilient, to tackle this trauma together, and to have good conversations, and to see where everybody's coming from, and to build a little bit of empathy. So I think that's a good thing that's come from this.
I think one of the good things that's come from this is it's bringing us together as a community. In spite of what we hear from some politicians, it's not the fact that we see things coming together a lot quicker than you think. And especially when it comes to early childhood, this has exceeded the commissioner's expectations. I can speak for all of us when I say that, because we've come together so much quicker than we thought we would. And part of that, I think, is a pandemic. It's forced us to, and to tackle the problem and correct it. And I think on the other end of this, we'll be a lot better and farther along than we are now, and we would have been because of what we are going through now.
Yeah, I was going to and concur with both John and County Commissioner Whiteside that just the community involvement with churches, we've got individuals and businesses who have began to come together and say, well, what can we do? And just the general concern saying we need to be concerned about the education of our children, from the least from the highest to the lowest, and all that's in between. So just it has generated some thoughts and idea. How can we be creative? How can we do some things differently? And how can we ensure that everybody, all of our youth, all of our students, all of our kids have an equal opportunity for education? So again, it pulls people together. People put some differences aside and say, let's sit down, talk about how we can make it happen. What is it that we can do? And I appreciate that the community living out that verse, that the African proverb, which says it takes a village to raise a child, and it really will. It's going to take all of us coming together and all of us having some creative thoughts and ideas how we can get it done. And so again, I appreciate that. That's what
Indeed. Well, thank you. And I would say for Chrissy and Susan, you both mentioned some positives, including parents being more attentive to some of those, micro symptoms that, on a daily basis, to hand washing. What else in terms of a positive have either of you seen since COVID, whether it's in health behaviors, awareness?
I feel like there's just been this flood of creativity, from the awareness. Being stuck at home, you get your chores done, then what? So then you have these opportunities to talk about the bird in the window, or this opportunity to go outside and do chalk art on the street. I've seen phenomenal art around the neighborhood just when I'm out walking my dog, and it's not by the adults. It's it's everything, right down to the political things with racism and all that kind of stuff. It's, but it's the children out there who are participating and expressing themselves. And I think that comes from spending more time with your parents. We spend 8 hours a day away, and now we're, in a sense, forced to be creative, become more aware, and share those moments of conversation and stuff. They're so important. They really make the world go round.
Indeed. Chrissy?
I just want to say how proud I am of our early educators in child care programs. They've been resilient, they've been flexible and adapting to these changing times. They've proven, that they can do this, and they're providing the service. And the CCHC program is proud to be able to support them. They've called us for many different reasons. Some of it was to answer questions, and some of it was that they just needed someone to talk to say, you're doing this, and you're doing it well. So please continue for our families and our children in the community. But yes, they're always, welcome to call, because all of us are out there to support them, to make sure that they're able to provide services to our families. So I just thank our child care providers and our child care community to make all of this continue for the best of our children.
Thank you. And so we are now at the near close of our discussion. But before we do sign off, I do want to ask each of our panelists in their closing to just provide today's viewers and listeners one key takeaway that you have as a recommendation, food for thought, or just that key takeaway before we close. And so with that, I would like to go in reverse. And so we'll start with Susan.
I would just say be vigilant. Be vigilant about your social distancing. Be vigilant about that mask wearing. It really is key in reducing the spread of this virus. We're in it for the long haul. I think, maybe we're halfway through, maybe we're a little further along. The vaccine may come out soon and be helpful as well. But this isn't forever. We're learning right now, and we will never forget what we learn, but we have to be gentle and persistent with each other. And that social distancing, that 6 feet is crucial. That hand hygiene is crucial. That mask is crucial.
Thank you. Reverend Hardaway.
I would say that what we see is that we're stronger together. We can make America stronger together, and that's what it's going to take. It takes a collective effort from all of us to ensure that we do the right thing for everyone, and that our education of our children, which is our link to the future, and they will help shape tomorrow. But we have to begin to shape them today as we are looking for them to shape tomorrow.
John.
One thing is I want to highlight the importance of licensed childcare, high quality licensed childcare in North Carolina, especially in Buncombe County and in Western North Carolina. If you're looking for good licensed childcare, I advise you to go to Mountain Childcare Connections, and they can connect you to a statewide database of all facilities that are licensed by the Division of Child Development and Early Education. It's important to have a safe place to take your child that's regulated by the state, and that so going to Mountain Child Care Connections is the place to go to find that.
Thanks, John. We'll make sure to put that also in the comments so that folks can access that. And next, Chrissy.
Prevention and control. And please call the CCHC program at MAHEC so that we can help you implement that in your programs according to that child care toolkit. And I have taught a lot of hand washing, and I have now jokingly said to a lot of our providers that I don't know if I'll ever have to teach hand washing again. They seem to get it. They know that it's got to be 20 seconds and to use soap and water and turn that water off with a paper towel, not touching the faucet. Yes, as Susan has reminded us, hand washing for everything. We want to wash our hands. So thank you.
Thank you. Jenny?
Everybody's saying great stuff. I think really the biggest takeaway for me is that there are so many people out there and programs to support, right? So whether you're a parent, whether you're a childcare provider, licensed, unlicensed, whether you're running a learning cohort, a pod in your backyard for your neighbors, right? Like, ask, right? The health department, you can call Chrissy, you can call us, you can talk to John, and we are answering all sorts of questions that I think people feel like are really bizarre. And I might have 6 people call me and say, I've got the weirdest question. And I'm like, I guarantee you don't, right? So just ask, and there are people who will help you figure it out, whatever it is. But there's a lot of support.
Three powerful letters indeed. Pardon for interrupting. Yes.
Oh, it's fine. Yeah.
ASK can really do so much to change a life and change a community. And with that, I would ask for Commissioner Al Whitesides for you to give the final takeaway.
Takeaway for me is to continue the collaboration, all of us, because I've seen for this, just for this effort, for this initiative that was started with pre-K, we have everybody working together in the community, from the Chamber of Commerce, which I've never seen before, an initiative like this, to the school systems and everybody in between. And the panel today, I would like to thank all of you and all of the people who are working to help make this a success. As a matter of fact, you're causing a big problem for us because we've got to figure out how to put more funds into it. That's going to be a challenge going forward, because we knew starting off it was not enough, but now we're finding out as we get it going. We didn't know how little it actually is, even though 3.6 million is a lot of money. But let's keep up the good work and working together. That's the key as a community, because that's the only way we're going to solve this problem. And thank all of you for what you do, and any help we can give you from the commission, please don't hesitate to call. And of course, you don't do that. Everybody calls us and we appreciate it, because that's how we find out what's going on. Yeah.
Well, thank you for those words of encouragement. Thanks to all of our contributors, all of our panelists today for the expertise, the time, and the information. To all of those who joined us today, the archive of the recording of this will be available on Buncombe County's Facebook page, as well as our YouTube channel. And you'll be able to access both the English as well as the Spanish, as was provided with simultaneous interpretation today by Cinzot Lake Language Justice Cooperative. I thank all of our panelists, and I thank all of today's viewers who joined us in this community conversation. And we invite you to continue tuning in, follow the 3 W's, and until next time, be well and stay safe. Thank you.